starting. We're going to pretend that the medic on the box is approximately 10 minutes out, so they got a little bit of time to do some patient care prior to arrival. I'm going to make myself the primary engine medic starting on scene. Because we don't have a dispatched call yet, the engine medic is going to start a new call and just do a normal chart. We're going to leave the strip tab blank because when we merge calls with the real one, this will be filled out from dispatch information. We will need something in patient information, and I'll show you guys why. If we don't fill out something within the patient information, whether it be patient name or date of birth, when we send it over the rescue medic, there's not going to be any identifying information for this call. Unless you guys know the run number, which by the time you get back to the station you should. So if we don't have a last name or date of birth or something from the patient, don't put in the address because that's going to get overridden by dispatch information. Same thing with dispatch complaint. So the patient name or run number, and the run number needs to be the right run number or you're going to mess with secondary medics, the medics coming in on the box. So let's put something in there. We'll open that back up. We're going to say the patient name is test patient. And if we don't have this information because maybe the medic on the box took the license, they're going to have all the information to fill out the rest of this. We're going to jump into subjective and go ahead and go through your report. So on this one, we're going to say this was a cardiac chest pain. This was a sharp pain. Happened 2 hours. Started 2 hours prior to arrival. No trauma. Past medical history. I say patient has diabetes and hypertension. Patient is taking metformin for medications and Diovan. There we go. No known drug allergies. This is not how to write reports chart for a class. This is really just I just want to show you guys how to be able to transfer and move. So I'm going to click through some of this pretty quick. Primary impressions, pain. Patient pregnant? No. Objective. Medical on the engine did perform an assessment that will have to be documented. It was performed by myself. No comments. Airway, we're going to say that was Peyton. Breathing, we're going to assume this patient had labored breathing and circulation was poor with weak pulses. He was ANO. Diaphoretic. Neurological symptoms, no blood or fluid loss. Body survey, we're going to leave blank. Impressions, chest pain, no trauma situation. Intent of injury, we'll leave that one blank. Was it a possible injury? No. And ETOH, none reported. No social alert. And cardiac arrest is no. Now, the medic on the engine is going to have to install or input any of their own vital signs. So we'll jump through. We're just going to say they did one set of vital signs within initial 10 minutes on scene. It was not done prior to arrival because I arrived and did them. jump in interventions. Like I said, we'll blow through these pretty quick. The only thing really left for the medic on the engine to complete is a narrative. So if we go to review narrative, and with the power of copy and paste, already had his narrative done. Come in here. Now this is not a real narrative, and again, this is not a class for charting. This is strictly just to show you guys how to transfer patients in between engines and rescues and the continuation of care. So the engine medic's going to document what he found when he arrived on scene, and he's going to end his report with patient care transferred to medic blank. From there, we are done. I'm going to send that to our inbox, and now that we have a patient last name, we know that the medic on the rescue is going to be able to identify this patient. So we're going to highlight it, select move. Now there's a couple of options here. Sometimes some of you may see this defaulted to vehicle. If I was to send this to a vehicle, let's say I know Rescue 14 came in, so I'm going to send it to Rescue 14. The problem is, whoever, for the receiving medic to be able to open to this chart, they're going to have to be assigned to Rescue 14, which normally isn't a big deal, but it's an extra step. It's going to be much more easy and convenient if the engine medic sends it directly to the person. So I'm going to use Ryland McDougall as my medic on the rescue. I'm going to select crew, type in McDougs, highlight his name. Now when I hit transfer or move, it's going to send it directly to Ryland's inbox regardless of what vehicle he signed into. Ryland will get the patient report in his inbox. I feel like I've seen a lot of open calls that have already been completed, and this could be a good possibility if guys are selecting copy when they're moving incident reports over. If I select copy, it's going to leave an open half-done report in my inbox, and it's going to send Ryland a report of the exact same one that's in mine. He's going to finish his, and now I have an open report that I can't delete that will always be stuck in my inbox. So unless you're doing multiple patients, which the copy button wouldn't be the one to use, I don't know why guys are hitting this copy button. So we're going to go ahead and move this directly over to Ryland's inbox. And now the engine medic has done his report. He sent it off to the rescue medic. And now we're going to pretend to be Ryland. In his MDC, he knows that I completed a report, and I'm waiting to send it to him. Oops. So Ryland logs in. Just so happened Ryland is working today and was working on a chart. So here is the patient that got moved from me as the engine medic into Ryland as the rescue medic. He's going to open this, request the PCR, and he's going to complete the remainder of the call. I'm going to come in. If we start from the beginning again, when we merge this call with our dispatch call, all this information here will be filled in. Patient information, now that Ryland has the license, he's going to know all the details and be able to fill this out. So I'm just going to make something up. I'm not going to fill out all this information. You guys get all of that. Billing. You can jump into subjective, has already been filled out by engine medic. Same thing with all the other tabs on the left. He's going to put in his own assessment that he received after. So he'll come down here and probably change the time of his assessment. If I was the one to give the fentanyl last, then Rylan showed up on scene, he's going to put himself in here and do his own assessment. The patient at this time has normal respirations and normal mental status. He's going to do his own set of vital signs. He's going to fill out his set of vital signs, or better yet, copy the vital signs that I took initially. He's going to change everything over to him. And actually, let's start off by doing this. The time for his vital signs will be after the assessment. Let's see, 2 minutes after. Blood pressure changed from 180 to 160 over 90. Heart rate came down to 70, and now he's strong. Respirations also came down to 16. His room air is up to 96. Now he's on supplemental. Blood glucose we didn't take again, so we're going to leave that. Everything else from here to here is the same. Let's say now his pain is a 3. He's no longer cool. He's normal. Normal. And we did not do, whoops, I forgot pale. And normal. So those are Rylan's vital signs. Now if we get go down here, so you can see the time did change to what Rylan inserted his vitals at. If he did any additional interventions, he'll start from my last intervention, which is here at fentanyl, and continue on to put in his interventions and finish up with the outcome of the patient. When he gets to his part of the narrative, he's going to come in here, and again we're going to copy and paste Rylan's narrative into his chart. And his chart is going to start with, upon arrival, receive patient care from Medic Azevedo. So this is going to show transfer of care of the patient between myself and Rylan, and then he's going to continue on with his narrative for what he did en route to the hospital. That should be it. Once he's done, he can complete his chart, print it, and send it on.